So today we're going to be talking about diabetes, and we're going to understand what diabetes is. So if you're interested in this video, just stay tuned and let's watch. We're going to be enlightening you on how diabetes happens and what is responsible for diabetes in you. Thank you so much. Watch this video, don't skip. Diabetes is a metabolic disorder in which sugar is built up within the blood in the form of glucose, causing abnormal symptoms. So, normally the body should regulate blood sugar through some metabolic processes, but at times this process can be altered. This process can be influenced by some other factors or causes. So let us know the normal regulatory process of blood sugar in the body. How is your blood sugar regulated that it will not cause any high blood sugar flowing in the bloodstream, causing diabetes? Let's understand the normal mechanism. So there's an organ within the abdomen called the pancreas, like this. So it's attached to the small intestine. So this organ called the pancreas, this organ releases beta cell, and beta cell this organ releases beta cell, and beta cell also produce insulin. So the pancreas releases beta cells, produces beta cell, and the beta cell produces insulin. So insulin is responsible now to serve as a link between the glucose that is within the bloodstream and the body cells. So let's look at this here. So we have the blood flowing, and we have glucose, and we have the blood flowing through here. So this is the bloodstream, and we have the sugar. So we have glucose flowing through the bloodstream. Now, insulin is released from beta cell. This is alright. So after eating, you have a lot of glucose built within the bloodstream. So how is the glucose breaking down? Now, the glucose is being taken by insulin and transferred to the muscles to be broken down for energy and also for storage. So some of the glucose are also transferred from the muscles, from the bloodstream, also to the liver. Remember, the liver is located in the right upper portion of the abdomen. So, assume we consider this as the liver. So some glucose are being broken down by the muscles, some are stored into the liver, and also stored within the muscles. If you have eaten and you have a glucose moving through the bloodstream, insulin is responsible to collect those glucose, transfer them to the muscles and organs like the liver for a breakdown, to other fatty cells for a breakdown. So if the glucose level is excess, some of the glucose are stored within the muscles and the liver as glycogen. So this process from the pancreas producing beta cells and this beta cells releasing insulin. Insulin takes the sugar from the bloodstream into the muscles to the liver for breakdown and storage to maintain regular level of glucose in the blood so that you cannot be having high concentration of glucose in the blood that will lead to diabetes. So this is a functional process. So this storage here, whenever the glucose level in the blood is low for the bloodstream, the body receives the signals and this organ called the pancreas also releases what we call glucagon on the opposite side. It's no longer beta cell, it's not beta cell anymore, but releases glucagon. This glucagon will take this glycogen and convert it back to glucose and transfer it back to the body cells for energy. So this is a natural process in which blood sugar is regulated. But there are some instances and factors that will influence this process. So what are those factors? What are those causes? Keep following this video. So going to the causes, there are two types of diabetes. We have type 1 and type 2. So let's begin with type 2. How does type 2 diabetes happen? Considering the factors. So as we get the types, we will be discussing the causes also. So with type 2 diabetes, insulin is produced. The beta cells releases insulin, but this is where the problem occurs. At this point where the insulin communicates with the blood sugar to be transferred to the blood cells, the signal to the body cell that insulin is available to aid the process of glucose absorption. That insulin is now recognized, so it is not allowed to function by taking sugar from the bloodstream to the body cells or to the liver. To this liver, let's get the liver correctly. So the insulin is now recognized. In that process, sugar will not be taken. So in that process, glucose will not be absorbed and it will continue to be getting larger and more at higher quantity within the bloodstream, and this is what leads to diabetes. So you realize that the liver too will not be able to receive those glucose for storage in that same process. So let's go further. This is how diabetes type 2 will happen. Increased glucose level in the blood. And what are factors that will prevent the signal of insulin to be recognized? Number one, we have genetic factors. Certain gene called RNRS. There's a receptor that receives the insulin for recognition. That gene has influence on the signaling of insulin. So, alteration of that gene maybe as a result of mutation or genetic fault, can lead to diabetes type 2. And this is why it is a diabetes that can be in the family line. So, another cause can be lifestyle, such as obesity. Very fat people, especially those that have a very big abdomen and have too many abdominal accumulated fats. Those fats, they have way of creating high blood sugar through the metabolic process, the conversion that we discussed, because they are one of the storage too. So very fat people are at risk of developing type 2 diabetes. Bad eating habits, eat excess food, not monitoring of glucose, can also fall on a lifestyle factor that cause diabetes type 2. And we have poor physical activities, lack of exercises, that will enable you to have energy being produced where glucose can be used at excess level. So once there's no energy, there's no breakdown of glucose. So under type 2, another cause could be chronic inflammation, and this is associated with obese people as well. So type 2 causes, let's take note of. So with type 1 diabetes, beta cells is the problem, and beta cell is being destroyed by what means? This is an autoimmune process. This is an error that occurs when beta cell, the body itself, destroy this cell. So when this happens, if beta cell is destroyed, remember, insulin will not be produced. And once insulin will not be produced, insulin will not function by allowing glucose absorption. So in that case, all the glucose that we produce in the bloodstream will go higher, and this is how diabetes type 1 happens. And type 1 diabetes is common in younger people, children between 4 to 6 years and 10 to 14. So this one children, and this one is puberty. So type 1 diabetes happens most commonly with these ages. It happens with adults, don't get it wrong, but most commonly with this age group. So we have other types of diabetes, other associated diabetes. So under type 1, we have other 2 types of diabetes, sub-diabetes types. One will have the ladder. So we have other types of diabetes. Under type 1, under type 1 we have secondary diabetes, and we also have LADA. This acronym. So secondary diabetes can be as a result of the use of drugs, certain medications such as we have the steroids and the beta blocker. So under type 1, secondary diabetes and LADA. So under secondary diabetes, what will cause secondary diabetes? Steroid use, prednisolone, dexamethasone, betamethasone, they are all steroid medication. They provoke the increase of sugar. The use of beta blocker medications, antihypertensive drugs such as propanol. propranolol. It has a likely effect on blocking the beta cell, and once beta cell is blocked, remember, insulin production will be a problem. So this is how secondary diabetes happens. Then this is LADA. So remember we said diabetes is common in age group children 4 to 6, puberty 10 to 14. But above 14 is where you determine this. When they get up to certain age, up to 25 to 30s, it's considered as, because the same process of beta cell issue will lead to that they can experience it. Sometimes the genetic process does not immediately surface until a certain age. So, latent autoimmune diabetes in adults. So when they become adult is when they start to experience type 1 diabetes. So under type 2, we get gestational diabetes. Why gestational diabetes? The issue with diabetes is associated with the endocrine system. And one of the organs that is associated with the endocrine system, which is involved in hormone production, the insulin is also considered a hormone, is the uterus. And the uterus is the one that carries the fetus during pregnancy. So there are certain processes that occur with the hormone, and it affects the uptake of glucose by the cell, the signaling of insulin. So this leads to gestational diabetes in pregnant women. That's some of the things that happen. So 2, we have the MODY. This means maturity onset diabetes in young people. This is diabetes type 2, and we say it's common within elderly people. But if it is genetic, it happens within, it starts to surface within younger people because of the gene problem, because of the gene. So young people experience type 2. Instead of not often it's elderly people, but young people experience it if it is genetic, where in the family line, and then it becomes this one, maturity onset diabetes in young people. So we also have other type of diabetes called diabetes insipidus. Diabetes insipidus is the failure of certain hormone called antidiuretic hormone to be produced by the brain that help to neutralize the process of fluid excretion by the kidney to produce urine, to neutralize it so that you will not have excess production of urine and frequent urination. So the production of that hormones is being impaired. This is what leads to frequent urination, and this is abnormal. It's a form of diabetes that we call diabetes insipidus. So let's get the symptoms. Number 1 symptom, you have unexplained fatigue, tired always and sleepy. So you have frequent urination, frequent thirst, and hunger, or excessive urination, excessive thirst, and excessive hunger. You have blurred vision. Diabetes have influence on the eyes. So there are cardinal signs and symptoms you will experience for diabetes. So when diabetes is left untreated, what are complications you will experience? So some complications will be, number one, we have diabetes. So diabetes affects the retina of the eye, diabetic retinopathy, and this can lead to blindness. That's one complicated sign. Two, we also have diabetic neuropathy. The nerves can be damaged as a result of high blood sugar. Diabetes can damage the nerves, and you have symptoms of numbness in the fingers and the feet. And this can also lead to feet ulcer, because once nerves are damaged, life is not flowing. It also influences blood supply to those parts of the body, most especially the feet. This can lead to amputation, dead tissues. So, three, we have diabetes. Diabetic neuropathy. This can be as a result of damage to the nephrons, tiny vessels within the kidney. They are responsible for the filtration process. So, if those vessels are being damaged, the kidney will not filter well, and this will lead to excess fluid flowing within the body, most especially in the feet, in your legs. And this can cause what we call edema. And pitting edema, where you press the leg and when you remove your finger, you receive a pit from your finger pressure at the point where you press the leg. So this is dangerous. Diabetes can cause death. So further complication, you will have heart attack, because once you start having problem with the kidney, there will be feedback, and once you are having issue with the nerves, there will also be feedback. So what will give rise to heart attack is that there will be accumulation of high level of cholesterol. There's a reason why when you are diabetic, often do your blood chemistry, do your lipid profile. Know your cholesterol. When it's high, you will be advised and be given medication as needed. So high concentration of lipids or cholesterol, what it does is that this is your blood vessel. Let's take for instance your blood vessel. Alright, so you will have blood content flowing freely. But because of the build up, because of the build up of high cholesterol within the wall of the vessel, it will accumulate plaque. So let's So plaque formation, from this point, the vessel is wider, but at the point where the plaque is formed is narrow. So this alone can lead to restriction, and then we call this sclerosis. So if this happens to many portions of the vessels, to multiple vessels, we call that multiple sclerosis. So this thing is a plaque. This is a plaque formed as a result of high concentration of cholesterol within the blood. So there are certain proteins of the cholesterol called the less density lipoprotein that can deposit those plaque, those form of cholesterol within the bloodstream at high quantity, and then they will stick in the wall of the vessel. And if they continue that process, they will continue to grow, and will cause blockage. Then blood supply will not go to certain part of the body, the patient will die. So this is how dangerous diabetes is. This is the reason why we need to go to hospital and do our assessment, get checked for your blood sugar every time. So let's get a diagnosis. How do we diagnose diabetes? if you get tested for diabetes, the test we need to do involve. So tests that we need to do for diabetes involve, so we say diagnosis, fasting blood sugar, hemoglobin, A1C, oral glucose tolerance test. So, whenever you test fasting blood sugar and you have a result on 2 occasions, if you test fasting blood sugar and realize you have more than 125 milligrams per deciliter, it's a sign of diabetes on 2 occasions. So before this fasting blood sugar should be tested 8 hours to 12 hours after meal. If you are eating, you should test fasting blood sugar after 8 hours minimum or after 12 hours maximum. So getting this result, more than 125 milligrams per deciliter is abnormal. It's an indication of diabetes, a suspicion. So here, this is hemoglobin A1C. This is a test that gives an average of blood glucose over the past 3 months that you have been having either regular sugar level over the past 3 months or high level of sugar in your blood over the past 3 months. So having A1C of more than 6.4% is an indication that you are being diabetic. It could be primary, it could be pre-diabetes. So the earlier you detect, the earlier you initiate your management, and if you can prevent, you also stand a better chance. So with measure, this is also done on 2 different occasions as well, each of them. So with this oral glucose test, after drinking glucose solution, 2 hours later, when you test, the swab be used in your mouth, the saliva should be tested with a swab, and then after testing, the glucose content on our swab should not be more than 200. Any measure above 200 milligrams per deciliter indicates high glucose level and sign of diabetes. So, how do we prevent diabetes? So the preventive measure, knowing the causes, let us do regular body exercises, which is on a lifestyle, and eat proper nutritional diet. So check out this video. We did this video for you to get best foods for healthy kidneys, and those nutrients, they are also essential for people who are diabetic. But do not only rely on them, further do your body chemistry test every 2 to 3 months. It's essential for you. Thanks for watching. Let's take our health serious.